Now we're going to talk about the topic of raw material availability. Maria, you just mentioned the raw material crisis, but we at biophyll still observe a huge demand for biological raw materials worldwide. So could you explain how the biotech industry is affected by raw material shortage?
Oh yes, well, we have a disproportional growth caused again by the COVID epidemic, because all of a sudden there is so much more need to test everyone, so much more need to vaccinate everyone. And then in the same time, while the biotech industry is growing, which is something very positive, even though growing too fast, in the same time, in order to grow the biotech industry as such would need a lot of raw materials. But these raw materials usually are generated in other businesses. And these other businesses, these other industries are still not functioning at 100%. And again, the reserves have been used up. And there is no new supply or not enough new supply, and in the same time we have an increased consumption. I'll give you two examples. The first example is, for instance, plastics, laboratory plastics. It sounds crazy, but think about it. The plastics are made out of byproducts that come from the oil industry. But well, we stopped traveling. We stopped driving our cars. So there is a lot less oil production, there are a lot less byproducts. The reserves have been used up, and in the same time, the biotech industry and healthcare is screaming about, give us more bottles, give us more pipettes, give us more syringes. Where do we take this plastic from? So this is the one thing. Then what we also see is human blood donations. The pharmaceutical industry works a lot with products that are based on human blood, and human blood must be donated. But people got scared during the pandemic, so they stopped going to donate blood, and there is a huge shortage as well. So, and that's still ongoing. We see that there is a severe lack of products, of services, and that's going to accompany us for quite a while.